The Victorian era prided itself on moral refinement and scientific progress. Yet behind the velvet curtains of medicine, some of the most educated men of the age practiced one of history's most disturbing treatments, clitoridectomy, the surgical removal of part of the female genitalia performed as a supposed cure for hysteria and disorderly behavior. In the 1800s, hysteria was a catch-all diagnosis. Women who displayed anxiety, depression, irritability, sexual desire, or even independent thought could be labeled hysterical. It was a term rooted not in science, but in centuries of misogyny. The word itself derived from hystera, Greek for uterus. Physicians believed that a woman's reproductive organs controlled her emotions, and that imbalances there caused nervous fits or moral deviation. Among the most notorious figures to promote surgical intervention was Dr. Isaac Baker Brown, an English gynecologist who practiced in London during the mid-19th century. Brown was part of a medical movement that sought to treat hysteria and female insanity through physical means. He believed that excessive sexual stimulation, especially masturbation, was the root of countless psychological and social problems in women. His proposed solution was drastic: surgically removing the clitoris to eliminate sexual desire and, he claimed, restore moral stability. Brown's clinic, the London Surgical Home, catered to middle and upper-class women. Many procedures were done without the patient's full understanding or consent, often justified by family members who deemed the woman difficult or troubled. Brown and his supporters described their work as moral medicine, a way to protect women from themselves and preserve domestic order. But the consequences were catastrophic. Victims of these operations suffered immense pain, infection, trauma, and lifelong damage. Some died from post-operative complications. The practice quickly drew outrage from other physicians, who saw Brown's methods as cruel and unscientific. In 1867, after years of controversy, he was expelled from the Obstetrical Society of London for professional misconduct. His fall from grace marked a rare moment when Victorian medicine acknowledged ethical limits, though the underlying attitudes that allowed such abuse persisted for decades. The roots of these ideas went deeper than one man. Across Europe and America, 19th century medicine routinely viewed women's bodies as unstable and in need of control. Treatments for hysteria ranged from confinement in asylums to forced rest cures, ice baths, and electric shocks. Sexual repression was not a byproduct of the culture, it was built into its science. Physicians routinely equated female sexuality with disease, and treatment often meant punishment. While Baker Brown's career ended in disgrace, versions of his ideology survived long after his death. Surgical corrections of women's behavior appeared in medical literature well into the early 20th century. Even Sigmund Freud's early theories about hysteria reflected the same belief that women's emotional distress was linked to sexual repression or deviance. Modern medicine now recognizes these so-called cures for what they wax of violence justified through pseudoscience. They serve as a sobering reminder that progress in medicine is not only about technology or discovery, but about ethics and empathy. The tools of healing in the wrong hands can become instruments of control. The story of clitoridectomy in Victorian medicine is not just about a failed idea. It's about the deep intersection of gender, power, and pseudoscience. It shows how easily social fears can disguise themselves as medical truth, and how long it can take to undo that damage.